Hearing is one of our body's 5 senses. As humans, we are constantly processing many different sounds throughout the day that help us to better understand our environment and the people in it. When a person has lost their sense to hear, we consider them to be deaf. Deafness is something that has been seen as untreatable for many years until scientists created and perfected the cochlear implant. Cochlear implants are electronic devices that are able to compensate for non-functioning parts of the inner ear. When the device detects sound, impulses are sent through the auditory nerve to the brain, creating an effect similar to hearing. When a child has a hearing loss, it is a cause for immediate concern because language and communication skills develop most rapidly during the early childhood years. The Centers for Disease Control recognizes the importance in early detection of hearing problems in children by recommending hearing screenings for newborns before they leave the hospital. For hearing-impaired infants and children, the cochlear implant may seem like the cure for deafness, and it can be assumed that deaf people are actively seeking these implants. However, the reality is the majority of deaf people are not advocates for the cochlear implants. The deaf community believes that their deafness is a way of life rather than a disability. Therefore, they do not find the need to be cured by receiving the implant. Also, the deaf community believes the increased ability to hear does not always determine successful interactions with people of the hearing world. The deaf community's point of view on cochlear implants may create anxiety for the parents of deaf children as they seek more information in regards to cochlear implants. Parents should make an informed decision and allow their hearing-impaired child to receive cochlear implants at a young age because research proves younger children adapt quicker to the implant, which increases the likelihood of developing adequate communication and social skills. To maximize the development of listening and speaking skills, cochlear implant intervention must occur at a young age. As pointed out in S. Detman's article, Communication Development in Children Who Receive the Cochlear Implant Younger than 12 months old, research shows that when the surgery is performed safely, children younger than a year old show positive responses both in adaptation to the cochlear implants and in successfully developing language and cognitive skills. Another example is shown in the documentary Sound and Fury. When a deaf woman is informed by her audiologist, the prognosis of cochlear implants is significantly better for a young child because they are still in the process of learning language skills. Perhaps another important consideration for parents to understand is the fact that children with cochlear implants are much more likely to interact socially with their peers at school than a deaf child. This means children with cochlear implants are able to enjoy age-appropriate social events such as dances, movies, games, and team sports. Children with cochlear implants are safer because they can hear the fire alarm, cars honking, doorbells, and other sounds that help them assess their environment for safety hazards. Also, independence can be achieved because their child will be able to talk on the phone, order at restaurants, and not be limited by occupational choices. Advocates for cochlear implants point out that children can still be part of the deaf community if they choose to identify with them. However, they may also identify with the hearing world as well. Ultimately, it is up to the child to choose their identity. If you are a parent or relative of a deaf child and would like more information on cochlear implants in order to make an informed decision, please refer to the following websites and advocacy groups. Cochlear Implant Awareness Foundation at www.ciafonline.org. Hearing Loss Association of America at www.hearingloss.org. Cochlear Implant Online at www.cochlearimplantonline.com. And chat for parents of children with cochlear implants at www.circle.org. If you are a medical professional, please help us continue to provide parents of hearing-impaired children appropriate information about cochlear implants. We feel it is important parents are aware of all viewpoints when considering cochlear implants, including the deaf community's position. Also, it is imperative that research for technological hearing devices continues in order to better serve the deaf community in the future. Finding out your child is hearing impaired is never easy. You and your child will be faced with many decisions and challenges along the way, such as hearing aids, learning sign language, and maybe even receiving cochlear implants. It is advisable to thoroughly understand and discuss all treatment plans with your doctor. If cochlear implants are an option, parents should grasp both the negative and positive aspects to receiving them. The ability to hear is a gift that current medical technology has enabled many deaf people to enjoy. Cochlear implants are truly a modern miracle. If your life has been blessed because of cochlear implants, we hope you consider making a donation to a cochlear implant foundation of your choice.